Hi, this is Chris from Care with Intelligence. I wanted to talk to you today about the brand new thing that's been launched today by OpenAI called operators. Operators, these are agents controlling computers. It's a computer using agent that can interact with sites using a browser and the controls and the cursor and a mouse, just like a human interacting with it. Possibilities for health and social care are endless. I think this is absolutely incredible. So I've managed to get onto a bit of a demo and a preview of this. As I said, it's only just been launched today. So I'd like to show you what I think is absolutely one, I think it's incredible. Two, I think there's some great opportunities here that are going to be coming up over the next few months for health and social care using agents. So I'm going to show you two things I've tested so far that I think are pretty amazing. It's going to now get started, and as you can see, it's now going to open up a window here. This is a browser window that it's just opened. It's now on the internet, and it's going to look for, first of all, it's going to have a bit of a search for the Kenmore Medical Centre website. So it's gone onto the Kenmore Medical website, and it's now looking for the way that it's going to make a doctor's appointment for me. So it's going to carry on browsing. It's going to click on the links to do it. It's gone through there. If this had cookies, it would be asking me whether I give cookie consent for it to pass on information. I've tested this earlier, so it's probably already got my settings for cookies, and it's already approved those. So now it's saying what would I like help with. This is all the pages on their website. This is the whole process that I would follow to create a doctor's appointment. So as you can see, it's reading what's on the page. I'm taking a screenshot and looking at it, reading it, understanding it, and then using the mouse and the cursor to make the selections of the things it needs to. It can even type in, as you're going to see in a few minutes. So there we go. We've got to the point where it's now asked a couple of questions. Now it's gone to the page for the medical request. So could you provide information about the medical concern? So I have a very bad cold. I was taking paracetamol, but it doesn't work. It's got worse. I think it's man flu. Now, I'm not going to submit this, so please don't worry, particularly as well if you're at Kenmore Medical Centre that I've been submitting this. So please don't go to your doctor and say, I've got a cold, I've got man flu. And this is just a demo of what it can do. So I'm going to go through here because this will actually ask for a final step before it completes the information. But now you're going to see it's going to start typing into the relevant boxes that information I've given it that it's asked for. So let's have a bit of a watch here. You can see here, up here as it's doing it. As you've seen, it just typed in, I've got a very bad cold. How long he's now asking for the next question? How long have you had the cold for? 2 weeks. It's now going to ask you how long it's been going on for, and it should know the answer to the next question, I would think, because it's already asked me what treatment I've been taking. So as you can see, this is pretty incredible. I'm not going to take this any further because obviously this is a real live site. This is a real live doctor's website, but that's just showing you the capabilities of what agents are able to do and this new operator with OpenAI. I promise you two examples of how operator can work. Here's a second example, and this is what I'm asking it to do. Is I'm asking it to go into my care planning system, into my demo environment, and I've said, look for this service user, and add one of my additional notes. I need it to be today at the current time, and it just should be just telling the carers that they should ensure that the front door is left unlocked when leaving, and it needs to be escalated to the senior care. Now, I've not tried this, so this is really a live demo. As I've said, Operators was only launched today, so you're getting a really good view of it straight away and my initial thoughts on how this will be fantastic for health and social care. So let's give this a little whirl and see what we come up with, shall we? So Operator now is going to be looking for the website. It's going to go to the website correctly. It's just done that for me. I'm just having a quick look there. It's going into, where it needs to look to find this for me. And then I've not taught it how to do this. Well, this is the great thing. It works this stuff out for itself as it goes along. So I'm hoping it will know it will try and work out where to search for a client. But let's see how smart it is. I can see that the cursor's moved over to the search box and it's dropped the name in straight away. That's amazing. I'm smiling as I do this because this, I feel like I just feel mind blown here, watching this actually happening in person. Some of the first people to be seeing this actually working is just health and social care, I think, could be revolutionised by this. So was our demo client. It's found where some of our additional notes are there. Demo additional notes there. So there's no confidential information there, so don't worry too much. And it's now hopefully going to, goes over the page to add a new additional note for me. It's putting in, I said today's date, didn't I, at the current time? So it's put today's date. My hands are here. Look, I'm just showing you. I'm not touching this. This is doing this by itself. This is amazing. It's going to complete as much information as it can. It might come back to me at some point and say, could you add a little bit more information? Or if you watch, if I put my mouse over, I can actually even take control. I can say, yeah, stop doing that. You're doing that wrong. Do it this way. So I could click on that and take control myself if I wanted to. Or I could pause the action. But we'll let it carry on. I think it's doing quite a good job at the minute, don't we? And so it's putting in the time. Let's work that one out for. Yep, it's putting a fairly good time. Let's see what it does there. It seems to be thinking about what the current time is. Yeah. Contemplating what it thinks is the correct time. Like it almost feels like I can almost see it thinking here. It's going up one by one. Actually, that's what it's doing. It's literally going up one, one, one because you have to click on the button to get the exact time right. Pretty amazing that. The details and notes, all carers should ensure the front door is left unlocked when leaving. I fill in the date, time and details in it. However, I need the name of the care staff member to complete the form. Yes, so we'll put my name in, shall we here? Chris Clark. My name's there. It's going to now drop that in for me. It looks like it's pretty much done. Almost. Let's see. It's oh, there we go. It's now putting my name in. My name's there. It's found that for me. It's escalating it to the senior care team as I asked it to do. And then it's going to go right to the bottom. My laptop's dying as I'm dying of excitement. Anyway, hopefully it's got enough battery to carry on with the rest of this video. I'm sure it has. It's done that. It's now said, I fill in the additional notes. Should I go ahead and submit it? Yes, please. That's the thing I love. It doesn't just go out and do stuff completely by itself. It will do all the actions and all the things for you. You can go away and come. It can give you a notification when it's finished what it's doing. But it does ask for confirmation on things that are important, like this when it's submitting a form or certain specific details it will want to confirm from you that it's happy and you're happy for it to go ahead. So as you can see now, it's there. It's now just going back in and it's just submitted that form. There we go. The form has now been submitted, saved. There we go. It's all in the system now. And I didn't actually do very much to do that. I think it's pretty amazing, the things that can be done with this. Considering this was only launched today, it's only been around for literally hours. So this was really a very, very quick overview just to show you what is going to be capable and what is capable currently to do. I'm very excited. I think that this can really well be implemented into health and social care. So many things we could be using this for. We could be looking at pulling off our incident reports, reviewing incident reports, closing incident reports, looking at actions that need to happen, getting your system to do those automated for you, doing research for you, finding out different information. I tested it earlier. I got it to go onto the CQC website and look for all the most recent reports for me and just bring them off for me. I also had a bit of a play around today. As I said, this has only been available for a few hours. So I played around with it, getting it to go and make a booking for me at my favourite restaurant in Wilmslow for next week for my wife and myself. And of course, it went away and did it, came back, made the booking for me. So there are so many opportunities just to explore with AI for your health and social care business. And that's what I'm about. So Care with Intelligence was born to see how we can help develop your health and social care business, make it more efficient, and use AI to improve what you currently do. I think so many people are doing great things in health and social care at the moment, but AI will help you make it and get it done even better. So I hope you've enjoyed this video. If you have, please subscribe at the bottom here and please give me a like. It will help me to understand which videos are useful and to be able to create new and other exciting content for you. Thanks. Have a fantastic day. Take care now. Bye-bye.